Thank you for having me. It is great blessings to be with all of you sharing our research. So this is the topic, determinants of country performance in the context of COVID-19. And we have evidence from New Zealand and the ASEAN. Okay, yeah. And so what are the objectives? The main objectives to examine the factors that explain the observed differences in national responses and performance in controlling COVID-19 with a focus on ASEAN and New Zealand. So to start with, we said this is a very exploratory research. As we know, things are still changing, uncertain world, and COVID has had impact worldwide with varying degrees upon and across countries. So, so this is a kind of original paper. And so methodology, initially we have used multiple regression analysis to identify the relationship between the factors, key factors, and countries' performance in controlling COVID-19. So we aim to apply much more econometric and relevant uh, methods later, but at this moment, that's what we have done so far. So start with, I have this some data, initial data. For example, this the most powerful country, and then Europe, then Africa, Western Pacific, then again Americas, Europe, Eastern Mediterranean, Southern Africa. So how many cases, and then so largest cases there. And that's very surprising because of the fact that technologically, GDP per capita, and many other attributes, the world leaders also, most advanced countries also have very, very deep, significant impact. And also the death rate. So death, human, loss of human lives, and much more higher in here than Europe, Eastern Mediterranean, Southeast Asia, Western Pacific, Africa. And changes in global government debt and overall fiscal balances, COVID impact. This one shows the government debt and deficits set to rise globally. So far, this is the data. More so than during even global financial crisis, 2008-10, following the global financial crisis. So this time, COVID impact is much more significant. Contraction in the output and ensuing fall in revenues, along with sizable discretionary support, have led to surge in government debt and deficits. So here we are comparing this global financial crisis, and then this is COVID impact, very deep, very large, and this is the again global financial crisis and COVID pandemic. So fiscal balance. And this is COVID impact country fiscal measures in response to impact of COVID as a percentage of GDP. So this is different countries selected. Okay. So countries are providing sizable fiscal support, stimulus through budgetary measures, as well as of budgetary liquidity. More than 2/3 of government across the world have scaled up their fiscal support stimulus package since April to mitigate the economic fallout from the pandemic and the stringent lockdown. And all transactions, this shows the COVID impact NZ, electronic card transactions, industry group monthly, so it shows the panic buying and more so consumable, right? Okay, you see here, consumables and durables and hospitality, services, apparel, motor vehicles, excluding fuel, and then fuel and non-retail. So you can see that there's some some drop, very drop. For example, fuel and all that, people locked down, so could not use much. But consumable goods, other goods on rise. Here, travel restrictions mean less airline and airport activity and hence reduction in profits or increase in losses. So that's for departure from New Zealand significantly reduced. Auckland Airport profit plumb decreased very, very significantly. Arrival from Australia into New Zealand also decreased. And that has another impact on the economy. Coffee impact New Zealand, total imports by New Zealand port monthly in terms of tons. Airport imports take a dive due to decrease in number of passenger flights where cargo is also carried in belly space here. And the upward trend towards April-May is due to freight carriers increasing their capacity, essential goods and all that, okay? So seaport imports are not impacted as much as airport. Yeah, this is economic indicators, New Zealand case. So GDP shrank 1.6% on quarter ending March 20 as travel restrictions and lockdown contributed heavily to the largest decline in 29 years. Services weighted the most to the drop as hospitality, accommodation, restaurant, and bars were among the most affected industries, falling 7.8 and tourism declining after the border was closed. Construction dropped 4.1% and the transport, postal, and warehousing industry declined or shrank 5.2%. The ANZ Business Confidence Index rose to 34.4% in June from negative 41.8 the previous month as the government lifted coronavirus-led lockdown. The stock of goods held by firms in New Zealand decreased by 513 million New Zealand dollar in the first quarter of 2020. This is a summary, COVID response support packages. So this summarizes how the French government and other governments responded to this impact, economic impact, social impact, and all this to combat the impact. Government support available. And this is COVID response, New Zealand, fiscal support, wage subsidy, paid. So here wage subsidy, right hand side, and total amount paid. So very significant earlier. And then this is wage subsidy extension, right hand side. So later on, after the lockdown. Then job seeker and income support recipients is quite significant during this period. Total income support, left hand side, and then job seeker, right hand side. So significantly, impact on unemployment worldwide has been very significant. We all understand that, yeah. So in light of the wide variation in national responses and performances in dealing with COVID-19 in minimizing deaths from the virus, limiting its spread, enhancing the chance of recovery of those stricken by the virus, and minimizing the disruption and cost to the economy, the question we address that why some countries are more successful than others in dealing with COVID-19. And so what are the determinants of national performance in combating COVID-19? So these questions. So we said, how do we measure? So three possible measures we thought, but we are going to extend some more. So confirmed cases and COVID-19 death as percent of population and recoveries as percent of infections. So third, these are the three most suitable for us to explore of 3, death as percentage of the whole population seems to be the most appropriate criterion. So because ultimately the success of a country is measured by number of lives that it is able to save or the number of death that it is able to prevent. So preventing infections or the spread of the virus is only an intermediate measure and should ultimately translate to the prevention of death or the saving of life. So one is the health expenditure as a percentage of GDP or the government budget is an indication of the priority the government and society place on public health. So the percentage allocation of health should have a negative relationship with the number of percentage of death from COVID-19. The higher the percentage allocation for health, lesser we expect the death. Other things being equal, of course. The available indicator is health expenditure as percentage of GDP's relationship with death and infections is expected to be negative. So these are ASEAN experience, SARS, MERS, and very other flu and the pandemic like. So I would like Professor Huzai to explain these aspects. But so hello Huzai, are you here? Hello. I think he's not there now. So these are some of the case studies we highlighted, like other pandemics. But among all those pandemics, we all know that COVID-19 has much more significant impact worldwide, and more so in ASEAN as well. So other like the ASEAN flu, Asian flu of 57-58 resulted in 2 million deaths, and the Hong Kong flu of 68-69 killed 1 million people worldwide. At the start of pandemic February, ASEAN plus 3, China, South Korea, and Japan, health ministers held a video conference in which they pledged to collaborate in preventing the spread of the pandemic and mitigating its effects. But COVID-19 also showed the limit of regional cooperation as each member country was practically left to fend for itself in dealing with the pandemic. So there's no global framework or regional framework emerge at this stage.
So 3 minutes left.
How many?
3.
7 minutes?
3.
3 minutes. Okay. So these are some of the other fatalities in. You can look at it. Okay, these are the countries, and we include New Zealand, lowest death, right? Okay, and case fatality, and this you can. All right. This is another factor that determine countries' performance controlling. So GDP per capita, Human Development Index, population density per square mile, okay, million, health expenditure, GDP ratio, and physician per 10,000 people, and corruption index, corruption perception index. The higher the corruption, of course, there will be less expenditure on saving lives, right? Okay, so negative relationship. Now, factor consider GDP per capita, population density, human development index, health expenditure to GDP ratio, health personnel, 1,000 population, my doctors and all that, corruption perception score. So GDP show how much society can afford. Health expenditure as a percentage of GDP shows the priority the government and society place on health. Population density makes spread of disease easy and difficult. Human Development Index shows potentially capability. Health personnel population indicates capacity to treat disease. Corruption reduces resources or misallocate resources for health. So this is the Asian flu aspect, 2 million, Hong Kong, 1 million, and other. The start of the pandemic. So this is, I have already explained, I think, okay. So we have hypothesis that COVID-related or disease death is positive related to population density. Higher the population density, higher will be the spread of virus, and more people will be affected and die. Relative negative relationship to health budget as percentage of total government budget. Higher the budget on health um, and on people, lower will be the death. Negative relationship. Health personnel per thousand or million population, negative relationship. Higher the degree of um, doctors, nurses, and equipment provided to them, lower will be the death. So positive relationship to the degree of openness, the COVID globalization has started from China and is spread to all over the world to such a magnitude, to such a significant. So higher the relationship, higher degree of openness of countries, higher is the risk. And so positive, death will be much more. Negatively related to index of good governments. So good governments, of course, will reduce the death, which our government has done that. Government country ties national debt GDP ratio. If GDP and national debt ratio is lower, of course the government has more to borrow. They can borrow and pay back, and investors may have very confidence for the government policies or stimulus. So fortunately, New Zealand has very low, among many OECD countries, low GDP, debt to GDP ratio. So this is the one we have tested actually, population density and GDP per capita, human development indicators, health expenditure to GDP, health personnel 10 per 10,000, corruption perception index. So this is exploratory and we got some results, okay, that is GDP, HDI, population density, and then health expenditure and those other aspects we explain. There's some corruption perception index we get positive, so which is puzzling result, and by other results confirms our hypothesis. But corruption, sometimes those countries, as we know, Asian countries, are very high, many developing countries, very high degree of corruption. So misallocation takes place. Sometimes farms and other people willingly pay the bribes, pay to the official in order to get things done. So that rather than delay and all those things. So that may be the reasons are having, but we are going to explore further measures in order to check on that. So that is our intensified and okay. So what we suggest way forward in ASEAN and for New Zealand as well. So we intensify information sharing and dissemination on best practices among ASEAN member states. Then financial pooling and assistance, establishment of ASEAN Research Center on communicable disease and pandemics with following tasks. Continuously and closely monitor the occurrence and nature of emerging pandemics, solicit, raise and receive funds for resource on pandemics, conduct in-house research on pandemics, and or fund research undertaken by other institutions such as universities and research institutes. So further, because we know that ASEAN and New Zealand, Australia have established two regions a free trade agreement just few years ago. And within that framework, establishment of an ASEAN, Australia, New Zealand Research Center on communicable disease and pandemic with comprehensive coordinated policy framework within two regions. Thank you.